actually a radiation therapist at Landmark Cancer Center, and we're going to talk about radiation therapy and chemotherapy and hematology today, which is what we offer at the clinic. Let's see. What did I put on this? Okay, so we are transitioning from Landmark Cancer Center to Genesis Care. We are located just on the south side of the hospital, so we're at 14th and Hartford. You're going to notice some changes going on. We've cleared out trees, we're getting new signage, and we actually have been there for over 20 years. My other radiation therapist was here when the building was built, so we've been here a while, just a lot of name changes. So we're going from Landmark to Genesis Care, which is actually a global company, and I'll talk about that a little bit later. Okay, and then who are we? So we, like I said, we provide cancer care and also hematology care. And so we've got 2 infusion nurses. We've got a clinic lead. Patty is the first person you'll see in the door. She's always a friendly face when you walk in. Me and Jeff, who do radiation therapy, and of course our physicians. Did I go backwards? There we go. Those are just that's our mission. If you want to go to Genesis Care, you can look at that. So radiation therapy. So radiation therapy is a way to treat cancer. We treat solid tumors, so we don't treat leukemia. We treat solid tumors with radiation. What that does is it uses radiation to actually damage the DNA cells so that cancer cells can't reproduce. We have different ways of treating.
One second. They're having trouble with the volume. You can tell a joke or something. Giving you a hard time.
Oh, it's okay.
Okay, go ahead.
Okay. So this is an image of a radiation machine. It looks really big and really scary, but it's really not. And then of course you have us, and we're pretty awesome when we do it. So we offer electron therapy, which is for skin cancer, so we can treat all different types of skin cancers. Those are fairly easy treatments, easy breezy. You're done in about 15 to 30 treatments. And then we also treat, like I said, the solid tumors. So we can actually treat just about anything that's sent to us. If we can't do it, then we'll get it to someone who can, but there hasn't really been one that we can't treat with radiation. So what we use is IMRT, that's intensity modulated radiation therapy. And so in the big top of this machine is a bunch of lead leaves, and we have 120 of them, and they kind of form shapes. You can make any shape that you want out of those, and so we can more accurately target the tumor and lessen the radiation to your normal healthy tissue. I think there was a study done once on the shapes we can make, and they were able to make a shape of George Washington, like you could see his face. So that's how cool we can get, and we can actually get down to a 2 centimeter by 2 centimeter area, so we can even treat really small brain tumors if we wanted to. The next thing on there is IGRT, that's image-guided radiation therapy on most of our patients now, except for electrons, because we can see the skin cancer. We can do the things on those sides actually come out, and we can either do x-rays or we can do a small CAT scan on the patient. So what that does is it goes all the way around the patient. We get to see the inside of their anatomy and match it up to our planning CAT scan that we did, and so we can more accurately treat it. So if we're treating a prostate, per se, we can scan it, we can see the prostate, we can see the bony anatomy, we can match that up so we know that we are giving the dose exactly to where it's supposed to go instead of just lining them up on the outside and guessing. So that's that. It's pretty cool. Well, I said that because that's what I do. I get to do that every day. And so here's a video of the machine. Maybe? So I was going to show you. So you go up and into the machine, and it just goes around you. So, and we can hit from different targets. So your cancer's here, and we can hit from all sorts of different targets instead of coming in just 1 or 2 sides and damaging a lot of the healthy tissue. This saves a lot of your healthy tissue that way. And so I'll move on to medical oncology because I can talk about radiation all day because that's what I do all day. So with medical oncology, we do chemotherapy infusions and we do iron infusions. So if you're low on iron, we can do that too. That's part of our hematology side. We also offer oral chemo, but that's just stuff that we send at home. Let's see. We do have 3 practitioners right now, Dr. Ahmad and Sheila Moss is our nurse practitioner, and they come into the clinic. Dr. Holland has been doing telemed with the COVID and virus and everything. But they do come in, like I said, with the radiation, we do treat just every type of cancer, and if it's something that they feel that they can't, then they'll send out to OU, or they can get second opinions for OU, and we can do the infusions here. That way, patients aren't having to go out of town for chemo, because that's just silly. They already don't feel good. So we can do just about any type of infusion that we need. So like I said earlier, Landmark, or Genesis Care is actually a global company. This is where we're at in the US, but we're also in the UK and Australia. So what that means for us is hopefully we'll start clinical trials and updating treatments, stuff like that. And so I think we're gonna see a lot of changes, good changes coming soon. So we are always taking new patients. And to get to see us, you can self-referral. We just need your records, but what we like is to have your physician send the referral to us, because they send all the records that way. Otherwise, we have to hunt down records, or you do. And if you are in the middle of chemotherapy, we can take you that way. So if you're getting chemo, like in the city or Wichita or something like that, and you're like, hey, there is a cancer center in Ponca City, we can easily transition you into our chemotherapy infusion center there. You just set up one of our doctors and we start your infusion. Radiation therapy is a little different. If you really want to, it can be done. It'll just delay your treatment a little bit, but chemotherapy would not be delayed if we took somebody in from another clinic. Those typically, we can get them done in a couple of weeks. So, any questions? I know I kind of blew through that, and there's a lot that goes into cancer care, but I didn't want to go over my time. I didn't want to talk too much, because I can talk all day, and I talk really fast. So now I'll take your questions.
You said you're transitioning to Genesis Care. How quickly will it be before that's finalized?
Transitioning to Genesis Care, we're in the middle of it right now. So we're implementing a lot of their policies and everything. So we're waiting for signage. So signage has been put off because of COVID. Like, we just got part of our uniforms earlier this week. And so nothing real, like inside the clinic, you won't see a whole lot of changes. You're still gonna see the same staff, and you might see like some updates throughout the clinic. You're gonna have the same physicians and everything like that. Now we might be able to bring in more full-time physicians. So we are merging. I don't know, like higher up on the scale, like if we're completely merged or if we're still merging or anything like that. But it is a merger. We haven't been bought out or anything like that. So.
How has the COVID and all of this that's been going on for, let's say, the last year or so, how's that affected your business or people coming in, or have you guys had to change and adjust a lot?
Okay, yeah, with COVID, we have had to change and adjust, actually. So I say business-wise referrals are down just because people don't want to get out to the doctor, unfortunately. So I have a feeling when we get to where COVID is kind of leveled off and really down, we're going to have a lot of like more advanced cancers, because people don't want to get out and go to the doctor, which, I mean, not a lot of stubborn people here anyway, like farmers and stuff. They don't want to go to the doctor, you know, or just, I don't know, stuff. My dad's pretty stubborn too, so I mean, you know. So that's gone down. Now we have changed the way our clinic works. So right now, if they're coming in for radiation, it's just them coming in. We have them wait in their cars until it's time for them to come in. We're limiting how many people sit in the lobby. If you are coming in for a doctor's visit, like a consultation, or if you're getting results back, then you can bring a person with you. Everybody's wearing masks, doing temperature checks. We're doing COVID screenings every week for the patients. Like radiation patients are in every day. So we screen them once a week just to make sure. And if anything's changed, they're really good at telling us or calling us saying, hey, we've been exposed, and then we actually have a COVID team that we get with and see what we need to do. We've upped our cleaning, which we would clean before, but now it's like some deep cleaning. Got one of those sprayers, we can spray the floors and stuff. So That's changed. If they're coming in, like radiation patients see the doctor once a week, if they don't need someone coming in listening to them, it's just them that sees the doctor. Same with the chemotherapy. If they're just doing a follow-up saying, hey, your labs look great, you know, if there's no serious results giving, it's usually just the one person. And then we can always call or FaceTime their husband, wife, kids, or whatever if they need it.
Kristen, how are you engaging the medical community, the doctors, the hospitals, all in the area to know what you're doing and getting those referrals?
Well, I'm trying to engage with the physicians too, because I've taken on a bit of outreach. And so luckily, between all of us in the center, we do have some sort of communication with the physician offices. But I try my best to hit the physician offices saying, hey, do you need anything from us? Are we communicating well? Don't forget, we are over here. We take all sorts of types of cancer. So with COVID, when the numbers get really high, try and send faxes out. That way that's not an added person coming in that doesn't need to be in their clinic. But a couple of weeks ago, I did take some goodies and stuff and had a little note in the back saying, hey, yes, we are here. We're seeing your patients. We're seeing all radiation. We're seeing all chemo. We're treating them here in town. So it's just kind of getting that transition back, because there for a while, during our transition to Landmark, they kind of went somewhere else. So we're trying really hard to hit that, and then once we get more with the Genesis Care, I think they're going to try and hit harder with some marketing.
Okay.
So, yeah, get some marketing up here. Any more questions? Yeah.
Is there a large clientele for cancer treatment in Ponca?
There is a large clientele for cancer treatment, yes. Yes, unfortunately, yes. We have been in the past very, very, very busy. Normally, I mean, with COVID, the numbers are down, but normally we might slow down maybe towards Christmas because people don't want to do anything during the holidays, and then summertime people go on vacations. But normally, we have about 10 to 15 radiation patients on getting treatment at a time. Which is good for us. It's a good amount of numbers, like if you want to talk numbers. And then they have a lot of chemo patients right now. But yes, we get patients from Ponca, Tonkawa, Blackwell, Caw City. We even get some from Fairfax, Hominy, and then like the surrounding towns. So even up into Arc City. So yeah, unfortunately there is a good clientele for it, for cancer care. And you know, they're not going here. I don't know where they're going, but they can get treated here. A lot of people are going, I didn't realize we had a cancer center. Yes, we've been there 20 years. It's kind of hidden, but we are here. So.
How about you make that more apparent in the community that you are able, because I was not aware.
I'm trying to get us more apparent in the community. So before we haven't really had like someone going out and doing community things, saying, oh, I'm from the cancer center, going to all sorts of different community things. So when we actually started merging with Genesis Care, I kind of came up to them like, hey, like I think we need someone in our community. It's a small community and we do a lot of events in the community. I think we need somebody who goes out and goes to these meetings or events saying, yeah, because this is what I love to do. I love treating my patients for radiation therapy, but I also like getting our name out and doing things for our community. So we're working on it. So I'm kind of trying to split both times right now. So when I'm not treating, I'm doing things like that. So which has kind of gone down since COVID. We're not doing a whole lot of extras, but we're working on it, trying. Any more questions?
Where's Molly?
Yeah.
She's not here. Are you gonna do
Go
it?
ahead, Robert.
Well, this is Molly's favorite question.
Okay,
What can the community do to help you?
the community can help us by getting the word out. Just because a lot of people don't know we're here, and so if anybody is diagnosed with cancer, we can handle it. And if that's something we can't handle, then we'll send out, but there's no reason for them to be sent out first, unless it's like for surgery, of course. And then they can come see us. So we can do just about any type of chemo, any type of radiation. If that's not something we can handle, we'll send out, but we can handle most of it. So really just word of mouth is great, because a lot of, like she said, she didn't know we were here. A lot of people just don't know we're here. So they can, you know, if the doctor wants to send them over to the city first, and like, hey, there's one in Ponca. We've had a lot of patients go, no, there's one in Ponca, send me to Ponca, and the doctors will send them to Ponca first. So,
And I only asked that question because Molly's not here. I'm not taking ownership for her question. So you were probably afraid to.
yes, sir.
I just had an observation that
Yes.
the perception I had, and this is just for my perception, there was a cancer center there and it closed, and I thought it was closed, and that's my perception of what.
Right,
was happening.
yes. So with us being closed, yeah, that did go around the community. So what had happened is when we merged with Landmark, the first time Landmark bought out the building, we were still open. We were there, but we weren't really a presence. I think Dr. Ganapay was still having his practice there. So that's kind of what happened is some of us were still hanging out. We were working on getting physicians to cover and everything. So yeah, there for a few months we were virtually closed.
Because I knew Fairfax people going to Stillwater,
Mhm.
because they couldn't come here.
Exactly. Yeah. So there for just a few months we were closed, but we are open now and fully functioning.
Okay.
Yep.
And since you're on that board, you'll make sure they're aware.
I will.
I have to put him on the spot once in a while. Because he does me all the time.
That's right. Some people just need